Hey guys, my name's Stephen McLean, and I am going to be taking you through my presentation on stroke. Okay, what is a stroke? A stroke occurs when blood supply to a part of the brain is reduced or interrupted. When this happens, it prevents brain tissue from getting oxygen and nutrients. Brain cells begin to die within minutes. A stroke is a medical emergency, and it is crucial the person receives prompt treatment. Early action can reduce brain damage and other complications. Strokes can appear very differently from each other, and it is important to know the warning signs. Okay. Symptoms of a stroke. Trouble walking. Stroke patients may stumble, lose balance, or feel dizzy. Headache is another one. Sudden severe headaches may occur. Trouble speaking or understanding spoken language. Patients may feel confused or have trouble with pronunciation. They may slur words. Numbness or paralysis in the face, arm, or leg. So strokes usually attack one side of the brain. So if it's your right side of the brain, then it will attack the left side of your body. If it's the left side of your brain, it'll attack the right side of your body. Not always like that, but usually is. Vision problems. Sudden blurred or blackened vision can occur. And if you guys look at the image to the right, you can see the acronym BFAST, and that's just a very commonly used acronym for knowing if someone's having a stroke. All right, there are two main types of stroke. An ischemic stroke, which is the most common type. I believe it's about at least 3/4 of all strokes are ischemic strokes. Blood vessels to the brain are blocked or narrowed during an ischemic stroke. And when that happens, blood flow is severely reduced to the brain. It's caused when fatty deposits or blood clots are lodged inside the veins, and they most often come from the heart and can get lodged in the blood vessels in the brain. Okay, and then we have a hemorrhagic stroke, which is the other main one. And that can occur when a blood vessel in the brain leaks or ruptures. So it's a little bit more serious than an ischemic stroke because the blood pressure is so high that it's having the vein actually burst or leak. It can come from a variety of different factors, such as high blood pressure, aneurysms, trauma, and also protein deposits can lead to weaknesses in the vessel unit. So the wall of the blood vessel will break down from the protein deposits, and blood will start spewing out of the vein. It can turn into a hemorrhagic stroke from an ischemic stroke. So if the pressure becomes too much for the vessel to handle from an ischemic stroke, from the blood clots or the fatty deposits, it can go from an ischemic to a hemorrhagic stroke, and the blood vessel can burst. Okay. These are some interesting research facts that I thought I would share. It's estimated that 7 million American adults are living with a stroke. Stroke still remains the leading cause of long-term disability in the U.S. One person every 45 seconds suffers from a stroke. And in 2019, stroke accounted for 1 in every 19 deaths in the US. And last but not least, 87% of all strokes are ischemic, as I mentioned earlier. Okay. All right, these are the risk factors. Being overweight or obese, physical inactivity, so sitting at home, being a couch potato, just not doing the bare minimum of physical activity. Heavy or binge drinking, illegal drugs such as cocaine and methamphetamine, high blood pressure or cholesterol, cigarette smoking, cardiovascular disease, diabetes, and sleep apnea. And if you look to the right over here on the image, that just shows, it's a quick little image about all the risk factors. Okay. Complications after a stroke. So we can have changes in behavior, self-care abilities, and emotions. Stroke victims may start to need help with daily activities, chores, and grooming. Something that they're used to being able to do every day. It can get frustrating because they don't have the physical ability to do it anymore. So they do need assistance. Paralysis or loss of muscle movement or function. So if you look at the image of the two bodies over here on the right, it shows that damage is done, when damage is done to the left side of the brain, then you may lose function on the right side or parts of the right side of your body, and vice versa. Okay, memory loss, difficult thinking, reasoning, and making just judgments or understanding pretty simple concepts can be very complicated for stroke victims. Pain, random pains, uncomfortable tingling sensations is a big one, and numbness throughout the arm is another one that we see a lot. But one of the biggest things is difficulty talking or swallowing, because of how it affects the muscle. It can affect the muscles in your mouth, which is really bad because then you're gonna have trouble talking, just forming words, moving your tongue, and then it gets into eating and swallowing, and so people have to go to therapy to help rehab those muscles and help get them activated again so we're able to eat. Okay. Medications, common medications for stroke. Alteplase is an injectable medicine that dissolves blood clots and restores blood flow to the brain. It's usually only effective before the stroke, during the stroke, or within the first 4.5 hours after the stroke. If used after that, it has very iffy effectiveness, and there's really no point to administering it. Aspirin, which is something that a lot of people use, is used because it is an antipallets, which reduces the chance of another blood clot forming. So that would be a short-term. That would be for short-term use, and warfarin is an example of an anticoagulant for long-term use. High blood pressure medications, there's a ton of different kinds, but almost all stroke victims are on high blood pressure medications because that's what started in the beginning. A statin is a medication used to reduce the level of cholesterol in the blood. This is done by blocking, actually directly in the liver, it blocks the chemical enzyme that produces cholesterol, which is causing those blood clots and fatty deposits it's blocking the blood flow in those veins. Okay. Medication and exercise and how they affect each other. Okay. So Altiplace can make a person have feelings of dizziness. Aspirin can cause a fast heartbeat and difficulty breathing. High blood pressure medications can cause a lack of energy and dizziness. And a statin can cause muscle pain and a feeling of being physically weak. Overall, nothing too bad as far as how the medications are going to limit us in exercise, and yeah, how we're going to create that exercise prescription. So nothing too bad. It is something that we can work around. Okay, and this is my case study. So our patient Bob Yeager is a 75-year-old man who lives alone in an assisted living home. He suffered from an ischemic stroke to the right side of his brain 3 years ago. Before his stroke, he was very active and enjoyed playing with his grandchildren and golfing with friends. Bob has mild paralysis on the left side of his body from the shoulders down and uses a cane to walk. Bob has had a hard time accepting that he is physically unable to do a lot of the things he was able to do before the stroke, which in turn makes him frustrated and has led to him falling. He is taking Altiplace and aspirin daily, and his primary source of transportation is an electric scooter to get around the building. Risk stratification and group. Bob has gotten his blood pressure down to a normal range, and all of his ECG statistics look good. His biggest risks are feelings of confusion and muscle paralysis on the left side of the body. Our goal for him is we would like to gain walking stability and get some arm and hand activation in his right side. Special considerations for him. Based on the medications he is taking, we should watch for dizziness, heavy breathing, monitor heart rate, and he should always be spotted or assisted when walking or standing. We may have to cut workouts short or give extra rest time due to heavy breathing and lack of energy. Okay, exercise testing. The goal of our exercise testing for Bob is to determine functional capacity and cardiovascular response. That being said, our patient is not very mobile and only has function on one side of his body, so that's really limits us on what exercise he can perform for testing. But the test I chose was a modified cane assist walk test. So a patient will walk alone with cane in right hand, and he will walk for 25 yards. The patient will have a spotter on each side, one in front, one behind. The one behind will have a chair that's following him, and the one in front will make sure he doesn't fall forward. The whole point of this test is to see how smooth his walking ability is. For example, if he's dragging his left leg, then we know we have to work on hip flexor strength on that side to help keep that left leg up when walking. The test will be timed, and he will see if his speed and efficiency improves by testing biweekly. Imbalances and stability issues will be noted and taken into consideration with exercise testing. This is our exercise prescription. Pretty straightforward. Let's see. Yeah, we're going to keep the workouts not too long just because of old age and lack of mobility. Okay, these are my references. And in conclusion, exercise is the number1 way to prevent being at higher risk of a stroke. I really want you guys to hammer in on that and focus on that. And I hope you all have a better understanding of what stroke is, how to prevent it, and how exercise can be used in a stroke patient's life. Thanks for watching, guys.